And there'll also be time for you to raise your hands as well. So we'll be moderating that at about 12:35. The session is being recorded. Again, please use the chat box as you wish to connect and add insight. If everybody could please put their microphones on mute, that would be super helpful. And also feel free to put your view on either gallery or speaker view options. So thank you again, and over to Raya.
All right, now I'm thrilled to introduce our speakers today, Carol, Devine, and Trisha Khan. Carol is the project team lead for Climate Smart at MSF and was previously the Humanitarian Affairs Advisor with MSF for 6 years. Carol advises, researches, writes, and speaks principally on the impact of climate change on health, as well as on migration, healthcare under fire, and humanitarian principles for MSF. She has advocated for access to medicines and for respect for humanitarian principles and law before the Canadian Parliament and the World Trade Organization. Carol has worked for MSF in Rwanda, South Sudan, the Congo, East Timor, Kenya, and Peru. Trisha has worked for MSF for 6 years in a variety of roles and has over 15 years of experience in humanitarian program management and community engagement roles internationally. She is currently working on an initiative called Patients and Populations as Partners, based out of Switzerland. This initiative focuses on empowering communities and the patients MSF works with to participate in every step of project planning and implementation, from emergency startup to closure and handover. Trisha has worked in Bangladesh, South Sudan, and most recently, the Tigray region in response to the crisis. So my first question is the same for both of you, which is, can you tell us a bit about yourself and can you contextualize your work at MSF? What are the current projects you're working on? Carol, would you like to start us off?
Thank you, Raya and Danielle, and hello, Trisha, and thanks everyone for being here today. So your question, can you remind me?
Yes, can you just tell us a little bit about your role at MSF and current projects?
Sure. So you mentioned I'm the lead of the Climate Smart project. In fact, I just handed that over yesterday to an incredible woman named Katie Cowan, but for the last couple of years. So my background, I'm a social scientist, I'm non-medical, but I was really attracted years ago to MSF's work because of the practical nature of, medical care to those who are most excluded or who need it most. And I was also interested in the fact that it was founded by journalists that is lesser known and doctors. So this willingness and desire to also speak out, sometimes quietly, sometimes very loudly, as Trisha knows. I think that's really interesting too, because at times Band-Aids and feeding programs are not what people most need. And so it's also really great to hear about the program that Trisha's running, because this is where we have to go for humanitarian action to be adaptable, responsible, responsive. And so just to say, my work has been advising on ensuring that we're doing the best work we can for patients and populations. And then in about 2016, it became so clear to me that we had to, in a few places we were doing solar projects, we were talking about environmental degradation, but it wasn't institutional. So I'll just stop there and say that since 2016, 2017, have been finding the Pied Piper colleagues in MSF who also want to ensure we're thinking consciously about climate change in 3 ways. 1, how do we adapt our operations and our practices? How do we speak about it and advocate and witness and ensure patients and our 66,000 strong colleagues are being heard? And then what about mitigating our own footprint? So.
Thank you, Carol. Trisha, do you want to introduce yourself and tell us a little bit about, especially your new role?
Sure. Yeah, I mean, I think, you know, what Carol said about what first drew her to MSF, I could almost copy paste that. I think, you know, medical care, access to high quality medical care is something that I firmly believe that everyone should have a right to around the world. I do also find that one of the things that attracted me the most about MSF was this ability to speak about what we are witnessing, what people on the ground are witnessing, and as much as we can to you know, hand the mic over to people and communities that are being affected by you know, different situations. So the project that I'm working on currently, it's currently titled Patients and Populations as Partners. And like you mentioned, the idea is really to look at how exactly MSF can, as an organization, how can we start to shift the power back into the hands of the patients and the different communities that we work with throughout different types of projects and throughout the project cycle. So essentially from, you know, how do we do this in a startup project? How do we do this in an emergency setting? And how can we do this in a project that, say, has been, you know, in a place where we've been working for 20, 30 years? Really, this is it's a reflective exercise for MSF. It really is something that's going to hopefully lead to a culture shift in terms of empowering the teams that are on the ground to work really, really closely with communities, so that the communities are really the ones that are guiding MSF in this process that we have in terms of offering whatever support we can, so that communities are really responsible for their own health. It's a very new project. It's only just starting out, and so we're just creating the framework and the concept and everything right now. And it's going to be, it's definitely going to be something that we figure out as we go, let's say, which is again something that I do appreciate about MSF, is that there is that flexibility to try things, like Carol mentioned, the climate vein as well. So yeah.
Could you maybe expand a little bit more on the tools that you would use to engage communities and making sure that projects are sustainable after you leave?
Sure. So, you know, I think one of the first things that's the most important is that the communities where MSF works, the majority of our staff are 95%, 95% of our staff are people that are from those communities. And so really it's engaging with the teams that are in the different places where MSF is working to understand how exactly do they think is the best way for us to communicate with the communities that are there. And so what this might look like is, you know, holding focus group discussions, having meetings with certain influential people within the community, different patient groups or community groups that exist, just to create a bit of a map of who exactly is working in that area, or what exactly they're doing in that area, and then understanding what are the strengths and the assets and the things that they bring to the community that MSF can hopefully let's say support in any way, so that the community can decide for themselves what exactly they think would be some of the solutions moving forward. Really, it's a process that starts with a conversation. It's really about listening to people and having conversations throughout the process, right? Some of the things that I think we do look at when you think of traditional like community engagement or different types of models of care is what we call like decentralized models of care. And so it's having community-based programming, things like that. And that can be one aspect of it. So, you know, this program isn't a radical shift in terms of the activities that MSF traditionally does. But what is different is how we approach it, starting from the very beginning and making sure that communities are part of that conversation and deciding what is best for themselves. And then really trying to ensure that that ownership is there, and that the responsibility and the accountability is on both sides. Sorry if that wasn't a specific example, but I hope it was clear.
No, it makes sense. It's kind of, it seems to be more kind of in like the framework planning stage rather than like an implementation phase at this point, because it's such a new program.
Exactly. We do all sorts of types of activities that engage with the communities anyways, and that's all of that is a part of the process. But yeah, really it's really thinking of it as a way that we work, a bit of a shift in that sense.
I have another question for Trisha, actually, about, well, I guess, Carol, you can jump into about, like, can you speak to the adjustment from international work to being based in Canada? And I know, Trisha, you mentioned to me that you find it more difficult to be here in Canada sometimes than other places. So I was wondering if you could elaborate on this.
Yeah, so I mean, for me, I think it's interesting because I think there's generally a view of, oh, it's really hard to go to other places to work, and which I think, there's challenges that exist, I think, and whenever you're doing a job in which you have, a very it's different than what your day-to-day is, let's say, right? And so I think there's different challenges that come with that. But for me, I think some of the adjustments that I need to consider a lot are the sort of shift in terms of what can I accomplish when I'm in each of these places, and how exactly can I balance the schedule so that it makes sense, so that I'm giving everything that I can when I'm at work, but that I also have a balance in my life, and that I'm, making sure that I'm taking care of myself, and that my mental health is really something that's of top concern. I think that, sometimes the reason I say sometimes it's harder to come back is because, when you're working in internationally, oftentimes you're very immersed in where you are with the teams that you're working with, and to leave that and to come back home and then be with family and friends who might not necessarily always understand fully what your job is, which I'm sure in a lot of different professions that's the case. But it can definitely be a challenge. But I think really for me is having solid roots both within the organization and also on the personal side, and making sure that I'm finding ways to take care of myself that are consistent throughout. That's been, I think, one of the most important things for me.
It's interesting that you say there's a disconnect between like people at home and people you work with, but it makes sense as well, because what you experience is different than the day-to-day person living in Vancouver, Toronto, or wherever you may be.
Yeah, exactly.
I have a question now for Carol about how we must reduce our environmental footprint. We were just discussing before we started about decreasing how much we fly, and mitigating the climate crisis is not just about efficiency, but also sustainability and responsibility. And I was wondering if you could provide us with some concrete examples of how MSF is working to reduce its carbon footprint for us.
Thank you so much, Raya. And maybe just to echo quickly on Trisha's, response about working in Canada. And I really like that she said the word, balance and, adapting, because what COVID, like what we have going on right now, and I'll definitely answer your question about how are we concretely reducing our footprint. But I think what
for sure
your university is facing, everyone is facing, is what COVID, the horrors of COVID have also taught us. Or showed us, and at loss, but also gain. We were talking about reducing our footprint. We were talking about more digital work. Well, we had to do it quickly. If we were going to connect with colleagues across the world, we had to, we had to travel less. We had a travel ban. And that's not bad, because it links very much with the program that Trisha is working on. And, because of, as you mentioned, COP is happening right now, and you have the lower middle income countries and Indigenous peoples and youth and, most impacted people, regardless of the countries they live in, saying, this is our moment. This is code red for humanity. So what COVID showed us about we can digitize, it doesn't replace those wonderful interconnections. There's a woman on the call, Megan, who I met on the border with Guatemala, and beautiful things come from those human connections. But I think we're just going to have to accept that we're going to have less of them, and let's make them count. And, I consciously didn't go to COP also, through a few opportunities because of, I think there are people closer. So we're going to have to make choices, and it's not only for our conscience, but for the health of others. And there's going to be financial savings, and it's just the responsible thing to do. And not again saying never will we be together, because I think that has a lot of benefit. We just have to be very, very choosy, and we should calculate our footprint, because what we learned, as your question was about through MSF's work to reduce our environmental footprint is what you measure, you manage. And that's kind of a adage in, circles about, sustainability. But certainly, so what we started to do very quickly in MSF was we did a pilot. We said, we need to get a high-level diagnosis of our footprint, and that will have the conversations. And I really echo again what Trisha said about the solutions are going to be local. The communities will identify, okay, now we have the information about our flights, about our shipping, about our energy use, about our paper use, about our water use. And here's what we can immediately do, and here's what needs systemic change, or this needs a policy change. So we did pilots in 5 countries just to get this fast diagnosis of our main footprint, to drive our hypothesis that this was in 2018, 2019. Air freight, the supplies, the medical products, the tents that we send, the people that we send was our biggest footprint. And I can tell you that even before COVID, having those numbers of our flights made us change our behavior, some of it immediate. In Canada, when we saw how much we were flying within Canada, like anecdotally and through data, so up until February 2020, just before the COVID travel ban and the WHO pandemic was called, we had already started changing our behavior. And it was partly because of awareness and discussions, but it was because we looked at this graph and we went, oh my gosh. So anyway, we did the pilot in Canada, Geneva, Kenya, Mexico, and Honduras. We wanted a mix of offices and headquarters and medical centers. And what revealed about our footprint again was we have to, supply chain is complicated, but COVID also showed us that sometimes we're going to have to do more local supply, even if that's tricky. Like in Haiti, local supply might mean more deforestation. So a local solution is not always the best. But so just to say that we started with pilots that told us our big impacts, that told us to connect to the grid, go more digital, fly less, change our travel policies, and not only think about efficiency, as you said, Raya, but it made us look also at our responsibility. Flying less means more inclusive meetings, and using less diesel means more responsibility, less local pollution. Solar costs more money, but then we need to think about our donors and our partners. So I think I'll stop there, but there's great examples of some immediate changes and some longer term changes. And I would say supply chain is one of the more complicated ones, but then we need to reach out to those people we buy products together, put all of our purchasing power together and say, hello, drug companies, we want your drugs to be effective, affordable, and also sustainable.
I love how I don't love it, but I think it's really important that you say a code red for humanity. And the same thing with, instead of saying climate change, saying the climate crisis, I think shifting the rhetoric around that, I think is really important. And I did have a question as well about, you're saying that the local solutions are not always the best solutions. And that must be difficult for your position sometimes.
Yeah, and I don't mean
navigate that.
Yeah. No, thank you for clarifying that, because I don't mean that the local solutions aren't the best. People know what they need. People know their solutions. And for too long, it's been, we're here, it doesn't mean we weren't collaborating and consulting before, but now it's more conscious and purposeful. But I do want to say that this is more general. It's not about just local solutions. Sometimes we think we're making we're fixing something, but we cause more problems. We always need to be aware of the unintended consequences of our actions. And I'm not talking just about working with local communities. I'm talking about, everything we do. We have to be really conscious now. There's a lot of efforts to do geoengineering, to shoot things in the air to help. People come to us and say, what is your stance on geoengineering to fight the climate crisis? And we say, I don't know, show us your data. Have you thought about, shooting crazy stuff in the air might cause, heart failure? That's what I want to get to, the complexity that we all have to live with all the time. And, but I certainly think local procurement and local staffing, the skies are going to shut. COVID showed us that we shouldn't use carbon. So we need to think more regionally and locally. So thanks for that opportunity to clarify, I hope.
Yeah, no, thank you. That actually segues really nicely into my question to Trisha about how at McMaster, especially through the Global Health Program, we talked a lot about going local, global. So I wanted to ask Trisha how we can promote global health through local initiatives. And Carol, feel free to jump in as always.
Yeah, thanks for the question, Raya. You know, I think just continuing on with what Carol said, I think, you know, we do have a history of consulting with different communities and collaborating when we can, but I definitely think that where we're headed today, as you know, a sector in general, is to start thinking more about being very, very purposeful about that and what does that mean. And so for me, I think an awareness of that interconnectedness that we have on so many different levels, right? So global health, the climate crisis, decolonizing the humanitarian, the aid sector in general. These are things that we need to work together towards. And so I think just constantly having conversations about that. And so, you know, this event is a great example. The series of events are great examples of how, you know, we continue to sort of raise our collective awareness about issues that are important. On a sort of practical scale, I think shifting towards projects and initiatives that do really look at how exactly are we supporting communities to implement their own programming is really the way that we need to start moving forward. And so it's really starting to shift that idea from holding power just because you might be a funder or you might have that knowledge, is taking that power and shifting it into the communities where the needs are, or that there's a request for any type of support, right? And so really, really being community led and community driven, I think is of utmost importance. Yeah, I think, you know, one of the things, just kind of going back to that idea of us being really aware of how we are connected, is the pandemic is a great example of that, right? Like there's so many ways that we are connected that I don't think we really realize on a day-to-day basis. And to stop and take a moment to see that throughout the pandemic, I think is a really, really good opportunity for us to all think about, okay, so how exactly do we want to move forward, right? Not just in our work lives, but like also in our personal sense, in a personal sense, like what does this mean? Like Carol said, making decisions about where you choose to go, how you choose to work, the ways in which you choose to communicate with folks. So yeah, so for me, I think that's one of the most important things that you can do.
Mm-hmm. You also mentioned how I know, especially I learned a lot about this during my practicum too, about decolonizing the humanitarian sector. So I'm wondering if you can just kind of expand on that a little bit as well.
Sure. Oh, it's a big one.
This is a big topic.
Yeah.
Along with climate change.
Yeah.
They're related.
Things to tackle within an hour. Yeah, no. Do you know what I think? Yeah, so essentially we you know, I think we all have a level of awareness of the fact that you know, we do definitely work within a sector that has a very rich colonial history, and so a lot of the systems that were implemented that, you know, have gone on for decades, they still persist, even if there has been efforts to try to address those and to try to break those down. They're still very, very much present. They're in place, and we have to be really, really purposeful about how we start to break down those barriers. Having conversations is one thing, but I think where we are today is really pushing for solid action. And so that, I think what that looks like in practice is definitely a push to look at things like how exactly we are working in a community. I think is a very, very important aspect of that. What leadership looks like, and what the vision is in terms of how we bring people from our global workforce into conversations and are a part of solution creating for the future. I think is really important. But yeah, I think for me, decolonizing MSF and decolonizing the humanitarian sector in general really looks like a constant push forward to challenge what is the status quo and look at what we've always done and to say, well, why exactly are we doing it like that? And to just push for alternatives, right? And whether that's small or whether it's, for me, like an initiative like the one that I'm working on right now, it has the potential to be a real shift in culture for MSF, how we get there and how far we're willing to go. And especially in terms of that shift in power, what does that look like? Those are the things that we really have to keep focusing on, and those are the things that I personally want to keep talking about and keep pushing forward in terms of that conversation.
Carol has her hand raised.
I imagine Carol has some thoughts.
No, Trish, extremely well said, and I'm with you. I think I want to make the connection with the climate work because it's so clearly there. When we speak with, climate activists whose lives are literally on the line, like the killings of climate activists, the killings of Indigenous peoples who steward the majority of the biodiversity. It comes back to, yes, recognizing the colonial roots of the humanitarian organization, but in our activities like this, climate work, we also need to recognize about the incredible knowledge of communities and Indigenous communities about survival, of culture, land, life, ecosystems. And I think we need to, and we really want to be really conscious in our work to decarbonize that. Once again, it's not just do this, okay, we have to have targets because we need goals. Right now at the COP meeting in Scotland, the Paris meeting, we got to keep our temperature down and we need to do that together. So there need to be some so-called straight lines. But what I really appreciated when we started doing the climate work was having colleagues in Pakistan, for example, say, do we really need to measure every single project when this is a climate justice issue too? Like, put the energy where the big footprint is and model it and let us carry on with our work, but also recognizing the International Committee of the Red Cross, working with others. The ICRC is ahead of us on their mitigation work. And what I liked about looking at their work back in 2017 was they had, okay, we're going to reduce our waste, we're going to reduce our carbon, and we're going to put an indicator in is how we treat each other and how we are inclusive and equitable and diverse and how we treat employees. And I think that lens was seen, people were like, really? But I think now there's a really clear recognition that of course it has to be part of it, so.
I really like how Trisha said, like, we're all in this together, the same with, and that's really been evident through COVID. And then Carol, you mentioned how MSF or the ICRC came out with a report in 2017. But my question to you is, to what extent are MSF working with other humanitarian organizations abroad? I'm just kind of wondering about that. Is it kind of like everybody on their own, or is there a lot of collaboration between organizations?
Well, maybe just quickly on the kind of climate and humanitarian adaptation, mitigation, behavior change, culture change. It's so important that we work with others. MSF was traditionally known, okay, independence is incredibly important principle that you mentioned at the very beginning. And so independence to both criticize the government and then to work with them. That's a right we have to preserve jealously, because our safety, I was mentioning the attacks on climate activists. Of course, now there's wanton attacks on people who just want to give healthcare or give a water pump. So anyway, independence is really important. At the same time, the fight for HIV, we partnered more than ever. And they might be short partnerships and kind of surprising partnerships. That's the way to go. We need to always keep that independence in the background. In being public with one armed group, does that mean the other armed group attacks the pop? We need to have that in our mind. And our closer connection with communities is our safety, is our, legitimacy. But I'll say through the climate work, we've been really lucky. We want our tools to be open source because others have been very generous with us. Healthcare Without Harm, Public Health Institute of India, Global Green and Healthy Hospitals, different, even the public sector, we have a lot to learn from, but smaller NGOs that work on climate in Bangladesh, like we basically, we need to partner, whether it's short-term, long-term, we have to do it. Trisha.
yeah, the things you say, Carol, I'm like total agreement. I'm like writing down the things that you're saying. I agree.
So I did have another question about the importance of capacity building that I'm sure both of you could speak to as well. I know of the project in the DRC with solar panel hospitals. So I'm just kind of wondering what the steps MSF takes to ensure that knowledge is held locally and that power dynamics are mitigated. So I guess we kind of we touched on that a little bit, but.
I'll be super quick. And you mentioned the solar panels in the Congo, right?
Yeah.
And I saw photos, you know, it's so important how visuals are. Like I saw these photos of these guys in the Congo putting up like big pieces of solar with this incredibly beautiful green background. I'm going to post the link. And I just was like, what's going on here? And then I found the electrician Iñaki, who I think he's Spanish, but he consciously worked with local teams. Like MSF, as I said, has been using solar in Afghanistan decades ago, but it's not that solar is the only answer, but it's somewhere we have to go. So we have affordable, reliable, cheaper, and cleaner energy. But this quick project, not a quick project, but this big project we did where we put in remote energy for remote communities in a conflict area. And what I really appreciated about the approach was, we're going to think about cradle to grave. We're going to think about what happens to these panels when we leave and how are they disposed of. But importantly, it was who puts them in. And this is the change that's happening. Like before, maybe some flying electricians. Well, you know, what happened was they trained up and said, you know, you're going to have to repair them. This is going to be a long-term skill. We hope that more solar comes. Solar has to become the norm, not the kind of pilot project. But that for me was the important capacity building was, we're going to put this technology in, but we're going to do it with you and you become the experts in it.
Trisha, do you have anything to add?
Yeah, I mean, I think, you know, on the like logistics side and you know, the things that we can actually do in terms of the projects that are running in place, I think Carol brings up a really good point. And those are things that we, you know, like she said, we need to start thinking about what does it look like in terms of the places where MSF is working. How do we support not just the people, but the resources and the ability to hold everything within the communities where we're working. Just in terms of, let's say, maybe if we shift to like a knowledge sense, MSF does have a couple of different programs that aims to build up the different like leadership capacities and knowledge that will stay within, you know, the places where people are coming from that worked with MSF, which is all over the globe. And so we do have a couple of different things. So there's one called the MSF Learning Academy that really looks at like medical programming that people can take to advance themselves in their careers. And then we also have something called LEAP, which is a partnership with the London School of Tropical Medicine and it's Manchester University. And that was more in terms of developing the future leaders of MSF. And so offering them like master's level programming and things like that. And so yeah, and I think that the idea is that really, you know, we look at ways in which our staff that are working with us can move forward in terms of their own careers. Just a small example.
And I think it's fantastic too. Like when I first started MSF, I thought that you said 90 to 95% are local. I initially read 80, so I think that's a really important part of capacity building as well, in terms of having the most people working locally and not internationally.
Yeah, and I think, you know, the important shift there is that the people that are working in our projects, that it's really that they're, one thing that we are working towards, I think, is removing the barriers for people to be in all sorts, like all the different levels of management and responsibility within those projects. And so yeah, the idea is that, you know, there are expertise that are on the that are in the places where MSF is working, and yeah, the idea is to really highlight and focus on that and to build that up.
So we have 21 minutes left, so I'd like to open the floor up to questions from the audience now. So if you want to put any questions you have in the chat, or you can raise your hand. But I very much encourage you to ask questions at this
Yeah, and I
time.
just wanted to interject quickly as well. If everybody or whoever has the capability to do so, if you want to turn on your video, because we really wanted this portion to be a nice informal discussion with Trisha, Carol, Raya, and you all. So we'd love to see more of you if you feel comfortable to do so. And as Raya said, you can either raise your hand and we'll call on you to unmute yourselves, or you can put some questions in the chat box. I certainly have a couple questions, but I'm going to hold off and give the floor to the group that's here.
So, oh, I see that someone raised. Wait 1 second.
I think that might be.
Okay. Yeah. Ask away.
Thank you both for a wonderful, well, thank you all three of you for a one. I'm really interested in how COVID has affected climate and decolonization and all that kind of stuff. So in terms of climate change, you had mentioned that, Carol, you had mentioned that it was beneficial that we move so quickly into a digital space, decreasing our flying, decreasing the amount of carbon that we use, which is really wonderful. But I'm concerned about the effects that it might have on a digital divide, and that we need to make sure that we're including lower and middle income countries in this shift towards a digital world. And so what I was going to ask is, how do we do that? How do we make sure that that digital divide is not increased? And how do we do that, making sure that we're not reinforcing the colonial power dynamics, and that we're doing it sustainably, where we empower instead of just drop in and give these the capital needed?
Thank you. That's such a really, really great question and point. I appreciate it. So, you know, again, same with that unintended consequences, but that awareness and purposefulness. We're really conscious too that in, you know, we're having webinars. Okay, everyone, we're now go to this portal and you're going to get the information. Access is such an important point. And I think while we need to see our footprint go down, we also need to see our footprint go up. Energy access, internet access. And we have to keep reminding people it's not just the zero-sum game of down. Like the energy access during COVID, we needed, access to PPE, to the personal protective gear. That's what some of the local procurement became. And where we had to think about quality assurance and what were the conditions in those masks were made. Was it ethically, was it slave labor, was it child labor? But to get to your point about what COVID revealed and the fast digitization and the reduced flights, I mean, what we were aware, we had 300 distinct COVID programs. And certainly, I'm kind of going a bit wide here, but in Bangladesh, in Mexico, in Guatemala, women were really struggling by being more confined, and we had to be conscious to go to them. And so I think, COVID revealed certainly some ways of better practices that were forced, and we saw the global, carbon emissions went down, but only temporarily. And I think it made us aware in MSF about access to internet for sure is something that we need to consciously budget, think about, ensure if we're really truly decolonizing and being equitable, but also energy use. And COVID really shone a big light on that. Is some of the vaccines had to be refrigerated. What about in places where it's 50 degrees? So I think we, once again, we have to live with this total awareness and paradoxes and be sure not to repeat what we are trying not to do, but absolutely digital access and energy access and medical access, really important. And I think also capturing the footprint of that. And also those who work on remediation in artisanal mining sites and the recycling industry are giving us big flags and say, well, we're having electric cars, and like, again, who's doing the dirty work on this, and who's going to suffer health-wise. So we have always to be aware of who is most excluded or impacted. I hope that helps a bit.
Fantastic question too. Does anybody else have a question? Yeah, Dana. You can
Hi, sorry,
unmute
thank
yourself.
you.
Yeah, go ahead.
So hopefully this makes sense. I've been pretty interested in how climate change is influencing displacement and population displacement and how that will increase in the coming years. So I've been doing a bit of research on that, and through that I've kind of found a lot of research really advocating for these local solutions that you guys were both speaking to. But one thing that I found kind of interesting, and I was wondering if you had any advice on how to recognize the capacities of communities and investing in local solutions, while also recognizing that, like, given the colonial history, there's these solutions that communities are having to develop are often not a result of their initial actions, especially in the context of climate change, which is largely produced from like functions of the global north. So I was wondering how you guys as individuals and MSF more generally and global health workers in general might be able to kind of deal with that dichotomy.
Trisha, do you want to have a go thinking about Tigray or Bangladesh or anything, or do you want?
Okay, so just to make sure that I understand your question correctly, so the dichotomy that exists between working with communities in terms of looking at what the strengths and the assets are within the communities in terms of coming up with solutions, but then that those solutions themselves are sort of forced. Is that sort of what you're saying?
Yeah, that's pretty much what I'm saying. Yeah.
Okay, cool. Just wanted to make sure that I understood correctly. Okay, perfect. Yeah, I mean, you know, it's really, for me, I think it's like it's a question that comes up in so many different senses. That idea of, you know, I mean, philanthropy is a great example. The idea that, you know, to give is something that is supposed to help, but there's a power dynamic that comes with that, right? And so you see that, I think, throughout many examples of aid, the aid system in general, right? And so I think it's something that it's a debate that I think kind of is always one that comes back to these core questions of, you know, where does the power really sit and what exactly does it really look like, even when we are trying to be more conscious of those decisions to localize power and to localize decision making and things like that. For me, I think in terms of the program that I'm working on, one of the ways that I'm really thinking about this is really an organization like MSF that has a history of going into a place based on like a needs assessment, like understanding where potential needs may be or needs that have arisen based on whether it's a conflict situation or climate crisis or whatever that may be, is to really, again, sort of shift that way of thinking, right? Is we have communities that we have already worked with perhaps in the past or that we're aware of for other reasons that potentially are looking for support in some ways to address some of the needs that they may have, and to really look at it from a perspective of, okay, so what exactly are the strengths that are in your community, and how can we work within the community that MSF might have to come up with those solutions, locally. And so I don't know if it's super clear, but for me, it really is, it's looking at things with a different perspective. It's rather than looking at where needs are and then approaching a community to say, okay, we understand that this is potentially something that might, you know, we've identified this as a place. It's even just going back to the drawing board, and that's just the very first step, but that's the mentality for me that we need to take, is to really go back to the beginning and say, like, you know, have you approached us? Have you identified something? Is there a place that we are aware of that potentially could, you know, benefit from a collaboration or a conversation with an organization like MSF in terms of the services and the programming that we can support? But really having that direction and that creation be community led. And a big part of that is just being a really good listener in a lot of different ways, right? From the beginning, and as you're having conversations, is really listening and not necessarily guiding the conversation, but being a really good listener.
I know we want to, could I give a little quick example, or do you want to move on to another question? Just to enhance?
I'd love to hear an example.
Okay, Danya, that's a great question. And Trisha and I both worked in Bangladesh at different periods, but on the border with Myanmar, there's 1 million refugees. And, we talked about unintended consequences. So the teams asked us to help. Okay, what's happening? What's the science about climate change? Bangladesh is, contributes 0.03% to global carbon emissions, but is heavily impacted. Sea level rise, extreme weather events, cyclones, dengue outbreaks. Anyway, they asked us to help think about, okay, what knowledge would help make the practices more responsive and responsible. And so we went to the community, the Rohingya refugee community. And, if you've seen pictures or been there, it's, a really difficult geographic place with mudslides. And so we said to the community, we didn't use the word climate change because, of course, people know about climate change and are living it. But we wanted to really, as Trish said, just be active listeners, deep listeners. And we said, what are you concerned about? And they said, yeah, we know about climate change. We know that Bangladesh is ground zero, but here are our concerns. There is no internet in these camps. That's our mental health. That is how we share information about if you're pregnant or how is grandma. There's no internet. Our children are not allowed to go to school. We are not allowed to work, and we're going to be forcibly moved to the north near Dhaka. And so climate didn't really figure in, but climate was the backdrop and the front drop. And also we discovered that as we were doing this kind of climate lens, environmental lens, a hurricane or a cyclone was coming, Fani, and there weren't enough shelters in that region. So I think with these cascading crises and these overlapping, which is going to be the norm now, I think we have climate as a lens, but we really need to think about what are the most immediate needs people are recognizing. What can we help with? What can't we? But what could we, help amplify voices on?
Thank you, Carol and Trisha. Does anybody else have any questions? We have 10 minutes left, so I'm sure we have time for 2 more questions. Matthew has their hand raised.
Hi, thank you for speaking with us, and it's been a very interesting discussion. I just have a question about, can you speak a bit more about your advocacy work in higher income countries? Because I think, as you guys have both put it, that climate change really is, while it is disproportionately affecting people from low income countries, people from high income countries like Canada, the US, are the ones causing it. And without addressing the root problem of climate change, how a lot of your work has, a lot of what you've discussed about has been about helping people adapt to the changing climate, but what kind of work have you guys been doing about trying to address the problem at the root?
Yeah, maybe quick on this, and please add to Trish. It's a great question, Matthew. And I agree that, this advocacy, dual mandate that we mentioned at the beginning on climate change, we have been not where we want to eventually be in terms of advocacy, because we need to ensure our legitimacy. I mean, climate change, the climate crisis is unequivocal. The scientists are, together on this. We are seeing in our projects the impact, but we're stepping into the advocacy space. If you look at our MSF Canada Twitter, when the new government or the new ministers came in, when the new government came in, we're going to, for the first time, we have observer status at the only kind of multilateral climate meeting. And that's, in fact, of us just going, and we're not overstating our importance, but again, a 66,000 strong organization in 72 countries going to COP and saying, we are concerned, this is what we are seeing, is an important step for us. And while we're if you look at, I put in the chat a Lancet countdown where we make some key points. I would suggest that our advocacy is going to become, as important. Even our colleagues say, mitigation is so important, but it's adaptation and mitigation are so together. And one of our key messages is, even if tomorrow governments really, really make a massive change, the ripple effect for people, and as you said, most disproportionately affected and, you know, consciously excluded peoples, is going to reverberate for decades or millennia, even the science shows. So advocacy with respect to climate, with respect to COVID, you've seen we fight for, you know, access, health equity. So health equity and equity in COVID, in climate, is going to constantly be what we talk about, just like we did during the AIDS pandemic, when the drugs were cheaper in Canada, the US, and the UK than they were in South Africa, where 1 in 4 women were dying in the townships. So thanks for your point. And it's something I think we're building on. Maybe we've been a bit tentative because we don't want to look like we're greenwashing. We're understanding our own narrative, but we're going there.
Thank you, Carol. Oh, go ahead, Trisha.
No, just to add one small point. Yeah, great points, Carol. I think you know, one thing that also is important to mention is that you know, MSF as an organization, we don't necessarily, when it comes to climate, we don't need to be the experts. We are very uniquely placed in that we work with communities that have experienced or will be experiencing high levels of vulnerability due to the climate crisis, and we have oftentimes access to, you know, a history within some of those countries and some of those communities to how people have been affected and how they will continue to be affected. And so our ability to partner with others who are perhaps experts in certain areas or have a certain level of interest in making those connections, that's also something that I think we are a lot more open to now and that we've been really pushing for. And so, yeah, not necessarily, we don't have to be the experts, but we definitely do have an ability to share and to collaborate with others who are working really, who really are working in that space, and to you know, to really work in partnership with them to share the knowledge that we have as MSF, as a medical humanitarian organization.
And Ruta has their hand raised.
There you go, Paul. I just have one kind of overriding question here, and it seems to me that pandemic and climate change, these are both diseases, and the me ethos around the world, i.e. capitalism, is what got us into this problem. And I'm not sure that we're going to get out of this problem using the same tools. MSF, ICRC, you're all donor driven by the big corporations who are on the backs of capitalism. And I'm wondering if anybody has anything to say about that contradiction. I think Americans had a hard time with the pandemic because it's a me culture. At least half of them are anyways. Socialized anything doesn't fly in many places. And this is what we're faced with.
Thanks, Ruth. I mean, you've said an incredibly important point, and I think that was Einstein who was like, you can't solve the problem with the same tools that created the problem. And I think we recognize that. And will MSF start saying we are socialist, anti-capitalist? We have when we talk about drugs in the past. I mean, it's the market model for pharmaceuticals is broken, and it's anti-people and anti-equity. But I think that we also recognize we're one player who's adapting and constantly looking at how we're going to do it. And I think we're recognizing more through the program Trisha's running and other partnerships with this group Sea Change initiative that's coming up, is we're really thinking about how do that the power of the people who are most affected, those voices are incredibly strong and powerful. And we learned that doing HIV work. So anyway, I really hear your point. And I think we only take money from 3 governments. It doesn't mean some of our donors aren't, our private donors, we don't know where their capital comes from, but we try to be really conscious. Trish knows more on that side. So I want to hand over to her, but I thank you for raising it. It's a challenge, but I mean, like the architect of COP said, we need people on the streets talking to government. We need all kinds of approaches right now.
Yeah, I agree. Great. Yeah, really well put, Carol. Thanks, Raya. Yeah, and thanks for the question, Ruta. I think it is definitely an important reflection, like you said. It's one of the things that I think I I've really struggled with as well when you have conversations about the pandemic is the real me focus that we have here in Canada and other places. But yeah, just to quickly follow up on the one point that Carol was mentioning about the funding in particular. So yeah, someone had put in the chat that nearly 100% of our private donations. So MSF is typically, yeah, about, I mean, a very, very large percentage is our private donations. Like Carol said, we only accept or have in the past accepted from 3 different governments, and that's very, very specifically related to specific programs. MSF definitely has a policy when we are looking at accepting any funds that aren't coming from private individuals. And, you know, even now, as we do accept gifts from corporations, it's something that there can be a lot of debate within the organization about who exactly we are accepting funding from and what kind of partnerships is MSF benefiting from. And that is really important to us. It's very, very important to us because in the places where we work, people will look at our website. They will look at where our money comes from. They will look at our financial records. We have memorandums of understandings with all of the different groups that are in any country that we work in, and it is of utmost importance to us to make sure that we can be clear about who we are accepting funding from, which is again why we don't accept from a lot of different governments, and why we are really careful about corporations that we partner with. That being said, the whole idea of philanthropy in general comes back to that same point, Ruta, and so we're not going to get away from it, but we will try to be conscious about it and yeah, and do what we can while still, you know, benefiting from the system that we operate in, which is donor driven, like you said.
So we're at the 1 o'clock mark. I'd love to end with, on a positive note, with a word of advice for future global health professionals. So maybe Trisha and Carol, you can jump in there really briefly before we wrap up the discussion.
You know, for me, I think the work is challenging. It's rewarding. It's messy. It comes and it goes in a lot of different ways. You feel like you make progress, and then you feel like you get pushed back. But again, it's for me, it's what I think. You know, the most important things in life are those that are worth fighting for, as the saying goes. And it's not like it's a fight, but it does feel good to really be a part of work that is meaningful. And so, yeah, I really appreciate that all of you have joined today, and thank you so much for your time and your really thoughtful questions. And it really has been a pleasure to be here. So, and thanks so much to Carol to be with you again here today, and to Raya, Danielle, and the team for putting on such a wonderful event.
Thanks. And I want to echo, Raya, thank you for, you know, having this placement with MSF and bringing this from it, and Danielle and all the other organizers, and Trisha, always a pleasure to work with you, and all of you who joined, and some MSF colleagues who were chatting in the chat, and all the great questions that you've asked. Okay, quick points. Quick, lead by your values and your principles. If it feels wrong, don't do it. Change your mind. It's okay to change your mind and make mistakes. And I just took this Women Leaders in Planetary Health course, and it reminds me about where the magic happens is where you're uncomfortable and pushing yourself. So take risks, and also enjoy yourselves. We have to laugh a lot and collaborate. So I have to run, and I thank you again, and I humbly would love to stay in touch with you all. Bye.
Thank you. Thank you so much, everybody. It was lovely.
Have a lovely day. We'll send the recording once we have it.
Sounds like a plan.
Stay tuned.
All right. Thank you, everybody.
So much, everyone.
All right. Have a great day. Bye.
Just see what happens here. I'm just gonna remove